everyone. Thank you for joining Amethyst at Penn's June 2026 seminar. We're proud to offer this content through our Amethyst at Penn Hub, which stands for Achieving Maternal Empowerment and Transforming Health Through Implementation Science and Training. Funding for this hub comes from the NIH's Improve initiative, which aims to reduce maternal mortality, improve pregnancy, perinatal, and postpartum care, and to address the factors that have led to severe disparities and outcomes for marginalized groups. As a reminder, we will be recording this discussion and it'll be available on our YouTube channel for review after the session. Please feel free to put any questions in the chat, and there will also be time for additional questions at the end. This month, we're fortunate to have Dr. Micki Burdick here to speak with us on qualitative methodology in maternal health, ethnography, and field methods. Dr. Burdick is an assistant professor of women and gender studies at the University of Delaware and a co-lead of our Amethyst Engagement Core. Micki, thank you so much for presenting for us today. And with that, I will turn it over to you.
Thank you so much. Let me know if at any point anyone can't hear me or the slides don't go. I'm in a newer space, so I just want to make sure that everything's good. Like Casey said, I'm Micki Burdick. I have a background in, I have actually a PhD in communication studies and women and gender studies. And a lot of the methodology I've used in the past has been in-depth sort of interviewing, oral history, as well as ethnography. So I am curious, this won't be very interactive for the most part, but I'm curious if anyone in the room, if, any raised hands or any chat, if anyone has experience in doing fieldwork or dabbling in ethnographic methods of any sort. Okay, got one person. Great. Yeah, I was just curious kind of who I'm talking to in the room. Obviously, if you are someone who is engaged in these methods and you have anything to add, please feel free to do that at the end of this talk. Happy to talk to you today about these methods. It's something that I've been doing for a pretty long time. I have a book length manuscript in process right now that will be published in the next couple of years, and it is an ethnography. So I'm going to talk a little bit about that today as well, just to kind of give us an example, I would say. Let me see. So what I want to talk a little bit about first is, what is ethnography? I'm sure a lot of you have heard the term fieldwork, ethnography. Some of you maybe even have taken anthropology courses where you've learned kind of the basics of it, but I want to talk about it in its capacity to help us in maternal health and what that means for us as researchers when we're thinking about ethnography. It is a different way of thinking about research than maybe we typically do when we're talking about maternal health and implementation science. So I want to really understand the background of that. So we'll get a little theoretical on you, and I hope that's all right. And then we'll talk about what kinds of research questions are suitable for this method. I really want to make sure that the content today helps you understand if maybe there's a project that even if you're not doing a full ethnography or anthropological sort of study, that some of these methods might be things that you could use. And so if there are research questions that you have that you haven't really been able to find a method for, maybe this will hopefully help you a little bit. And then we're going to talk a little bit about a methodological practice of ethnography and fieldwork and qualitative methods through example. And I'll use an example from my upcoming book and thinking about work I've done outside of reproductive health clinics. And then we will get some kind of practical steps in so that if you are thinking about this, you can start thinking about it and actually maybe implement some of these methods. So let's first start with what is ethnography. And again, if you have any questions, feel free to put them in the chat and I'll address them at the end of our talk today. This won't be a super, super long talk. I want to make sure that we have time for questions or any kind of methodological things that might come up for you, even if they seem a little bit, out of what I'm talking about here. Feel free to ask questions about qualitative methodology in general, as well as fieldwork and ethnography. Thank you all for being here on a Friday talking about method. I love talking about methods. I think they're really important to understand when we're doing our research. So deep diving into that sort of meta analysis of methods is really important sometimes. And so thank you for all taking that dive with me today. So, what is ethnography? I want to start with why qualitative methods. I know a lot of you know some of this, but just to kind of lay it out for you, there's some basic ways in which our perspectives change when we do qualitative methods, which I'll talk about in a minute about sort of knowledge production and epistemology. But we really want to think about when we're doing qualitative methods, like why do them, right? We could measure things. We can do different ways of our sort of quantitative methods. There's lots of different methods within that methodology, but why qualitative methods? Maybe we want to find a new perspective. Maybe something's been talked about a lot through numbers, graphs, data, hard data, I would say, right? But maybe we want to think about new ways of looking at a situation or a problematic, right? We also maybe want to answer the why question of something. So instead of thinking about how does this thing impact this other thing? Maybe why does it impact or how does it impact this other thing, right? Which we can't necessarily get sometimes through that measurement. Data is always inherently biased. This is a hot take sometimes, but I do think that it's important to note, and we'll talk a little bit more about that. Sometimes you need an insider's point of view, meaning someone inside of systems or spaces and places or views that you don't normally get, right? And sometimes we can't find that in the broader data that we have available to us already or that we can collect within our systems. So we need to find a way to get data from outside of our systems or maybe in different systems. We also can kind of think through, not always answer, but think through ethical and moral dilemmas when we're talking about qualitative research. So even just bringing up problems or things that, maybe your data is giving you something to think about beyond just what you're seeing in your p-value. I'm not a quantitative researcher, but hopefully this is helpful. And then thinking about equitable understandings of a problem or solution. We're thinking about at Amethyst, we're thinking about maternal health equity and disparities, right? So I think it's important to understand that qualitative methods really do help us with equitable understandings of a problem or solution from the people who it most impacts. I know a lot of you are doing this work already and your sites are doing this work, and I've been lucky enough to be on those site visits where you've talked about the really incredible qualitative research you're doing. So I just wanted to kind of highlight this. Maybe these are things you've already known and that I know a lot of you are already doing. Because I'm a professor, I have to talk a little bit about epistemology. Epistemology, as you may know, is about the theory of knowledge. So where does knowledge actually come from? Epistemology is the way we see the research we're doing, right? I'll talk about that in a second. But where does knowledge come from is a really important question when we're thinking about the methods we use, because epistemology leads to our methodology and then leads to the specific methods we'll use, right? So, for example, some of you might, in your research, think about research through a positivist or positivism lens, right? And a lot of you probably do think this way in some aspects. Knowledge or truth is out there. We have to go find it, right? We have to go find the data to kind of tell us this specific truth. And research is separate from the researcher, that we don't necessarily influence the research data, et cetera, that we have, right? So this is a positivist view of research. And that data is objective so that we can actually measure something and that thing can be measured again and again, right? That maybe we have a measurement for something like maternal health outcomes or for postpartum problems or right morbidities, things like that. We actually have measurements for those things. And positivism says this data is objective. We can kind of tell if a hospital is doing well or not based on the amount of like morbidity, right, happening or mortality even, right? We've often measured maternal health through this positivist lens. But I would say in qualitative research, we actually take a very different approach to epistemology, which then affects our methods, right? So if you're thinking through a positivist lens and you think truth is out there and that data is objective and that there's no bias to it, you're going to go out and collect it and simply say like, this is the measurement, right? This is the data we have. This is the truth. Instead, in qualitative research and in sort of my disciplines, what we would think through is more of an interpretivist lens, which maybe you've also heard of before. But interpretivism tells us that there's not necessarily a truth out there to be found. So there's no such thing as having sort of an objective truth. So even our measurements are flawed in some way or they have biases, right? Human behavior is complex, it's not predictable, and there's not a scientific variable that we can control for. Interpretivism also says that everyone is biased, and that's actually okay. I know that sounds weird, but instead of getting rid of our biases, we actually understand what they are and their power, right? Which I'll talk a little bit about when we talk more about fieldwork. This is the paradigm for doing qualitative research. So interpretivism tells us all of these things, and this actually does influence the way we do our research, right? If we're taking a positivist approach, we probably aren't going to go and then talk to people and just have a conversation. Probably not going to go to a place and observe things. What we are going to do is do very specific measurements, right? In an interpretive framework, we realize that even with our biased selves, we can go out and do research and understand problems without necessarily having some truth about them, right? Obviously, just because there is no objective truth to be found out there doesn't mean that that there's not consequences to things, right? So don't mistake me for saying that things don't exist or that things like disparities or in maternal health don't exist. It's just that they're more complex than maybe just the ways that we can measure them in numbers, right? They do exist and they impact real people. And that's why interpretivism is important because we need to go out there and then talk to real people who experience these things, right? So that's the interpretivist lens, which is kind of the lens that I'll be taking today as we talk through fieldwork and people who do fieldwork take, right? And people who study and also do qualitative methods take when they're doing their research. There are lots of there are some types of qualitative methods here. There are a lot of them. Obviously, these are just a few that I've done in my past work and in-depth interviewing, right, is kind of going in and listening and being a little bit more open, having less structured questions, but also semi-structured interviewing is also important, especially when we're dealing with traumatic experiences, when we're dealing with more systematic approaches to our qualitative research. Semi-structured interviewing, going in with specific questions is very important. Autoethnography, which I know some people actually had questions before about when you signed up. So I will talk a little bit about that later on and how it's different from fieldwork and how it's a really complex other thing. Memoir and life writing, textual analyses, and then, of course, ethnography, ethnographic methods, and fieldwork. Many of these are not separate. They're often used together, as I'll talk about with fieldwork and ethnography. A lot of times, life writing, textual analysis, and in-depth interviewing happen. So methodology-wise, ethnography comes out of interpretivism, and the methods within that are varied as well. Ethnography specifically is immersing yourself in a group or community in order to observe interactions and behaviors. So from an interpretivist standpoint, we can't figure out why people do things, right? We are not, well, some of you might be psychologists and maybe you do that, but I don't do that. I'm not a psychologist, right? So I'm not kind of understanding why people do things. I'm understanding what the consequences of those things are, right? You can observe what they're doing and draw conclusions about them, right? And this is not about individuals or about individual intent. This is about the consequences of a group of people or a social phenomenon, right? So for instance, maternal health crisis, right? That's very broad. Who and what do we want to study within that, right? We might think about the hospital system as a place and space where that happens, and who might we talk to, who might we want to be around to observe and see and observe that phenomenon, right? About the sort of a maternal mortality morbidity crisis in the United States. You can do a lot of things around that, right? Within that. So it's not about individual intent, though. We can't say like, this one doctor is causing this problem, right? We can talk about the consequences of a group of people's actions, right? Even if they don't intend to do something, what are the consequences of those things? And there are many methods, like I said before, within ethnography as a broader methodology, right? It's important to note, so before I sort of get into some examples of this and stay a little bit more theoretical, that ethnographers, I guess, believe in something or orient themselves toward something called situated knowledge. Situated knowledge comes out of feminist and feminist studies, Black African diaspora studies, um, sort of comes from these more marginalized disciplines, I would say, right? Because it understands knowledge not as something that you gain from going to the top person, right? Yes, it's important to go to doctors and talk to them about their experiences. But situated knowledge tells us it's also really important to talk to the people that are impacted most by policies, right? By different kinds of disparities. And a lot of you are already doing this work, and a lot of you I know are already engaging in the sort of understanding of situated knowledge within your different sites because you're talking to the people and patients and communities that this impacts most, right? Situated knowledge is located, meaning that it's in a specific space or place, right? Whether that's geographical or structural or within a certain system. It is engaged. It is not abstracted, meaning that we're not just making claims about people, we're actually understanding what's going on with their lives. And it's therefore created in relationship, not separation from people. So, in a way that positivism often abstracts people into numbers, we're saying that we need to kind of actually do the opposite and zone in and zoom in on those people, right? And it focuses on the ways that structures and power impact individuals and communities as well. So, situated knowledge is an important understanding and theoretical framework for engaging in ethnographic and fieldwork methods. Now I want to talk a little bit about some research questions and how different research questions maybe create different ways we answer those questions, right? And so what I'll do is use the example of some manuscript length ethnographies that have come out about maternal health care or reproductive health care in the United States specifically recently, and talk about why I think that why we should understand that their research questions had to be answered through ethnographic methods and fieldwork rather than another method, right? So the first example is this book, The Business of Birth, Malpractice and Maternity Care in the United States. And it's all about how malpractice suits impact maternal health care and maternal health care disparities and morbidity and mortality in the US. And instead of doing, there's lots of ways we could get to that problem, right? And understand that problem. It's a huge problem. Um, and a positivist interpretation might ask, do malpractice suits in maternal health care impact maternal health care in the United States? Do they, right? So we might look at the number of malpractice suits. We might do some statistical analysis about outcomes and different kinds of outcomes for patients based on hospital malpractice suits, things like that, whether providers are willing to do certain things based on the number of suits, right? And what they have done, but we really don't know how and why, right? This impacts. So we can say it does impact because of these numbers, right? I'm being very flippant about the number thing because I'm not a quantitative researcher, so bear with me. Versus this author who asks how and why, right? Do malpractice suits in maternal health care impact overall maternal health care in the US? And so this author, it's a great book, is a sociologist who does a lot of different methods, but and does some actually answering of this first question to get to then answer the second question as well, and does in-depth interviewing and field work within maternal health care systems and talks to patients and doctors and goes to court and listens in on these suits, right? So this is a really specific way of understanding how and why these malpractice suits impact maternal health care. The second example is a book called Motherhood on Ice. Great title, great book. Um, and I kind of broke it up into more why specifically not just qualitative methods, but field work is necessary. So the author is doing an ethnography of specifically egg freezing in the United States. We see egg freezing as something that is happening more and more. We see the numbers go up. And we might say, okay, what's the impact of more women freezing their eggs today or people freezing their eggs who have eggs today, right? Um, we could do that in a lot of different ways, answer that in a lot of different ways. But in order to, we could also ask this in a more positivist way and think about like impact as numerical or as statistical, right? Um, versus why are more women freezing their eggs today? Right? That's actually something we might ask, we might find out qualitatively, right? We might do semi-structured interviews in some instance. Versus what the author's question is, and this is quoted from the book, what is at stake for women who choose to freeze their eggs while embarking on their quest for partnership, pregnancy, and parenting? Now, that is a broader question, but something that needs to be explored, I would say, in a more in-depth sort of field work way, which we'll talk a little bit about what that even means. But just to kind of understand that research questions do impact the methods we will use and the methodology even. Now I want to talk a little bit about an example from my own work that is related to reproductive health care. Of course, I study reproductive health care in the US and specifically think about reproductive injustice in the US. So, how people are criminalized for things like abortion or miscarriage in the United States is kind of what I study. And I think a lot about how different political factors and actors influence these different ways that things like abortion and reproductive health care generally are criminalized, right? So we're going to talk a little bit about fieldwork as method through my own example. Again, this is while I'm telling you about this, it's going to sound like, oh, I just did this and this. But I want to reiterate that fieldwork is something that's very time consuming. And I'm going to lay out for you exactly what I did, but it's going to sound maybe like, oh, that's chill, that was easy, but it's not. So I just want to kind of start off and caveat that. Um, so I study, like I said, reproductive injustice in the US, which is the racial, gender, and class discrimination related to sexuality, pregnancy, parenthood, and reproductive health care, which you all know well, based on your own projects, and just generally who you are as people as well. It's not just about abortion, but abortion is included, right? So, these are all women on the screen who have been, imprisoned at some point for having a miscarriage or for having an abortion um, because of restrictive state laws around abortion care in the United States. Pregnant people, we know as a group here, are surveyed and policed often in the US and in different countries. But in our country specifically, we often criminalize people. Even if we don't criminalize them, we shame them, right? Things like that. So it's important to understand reproductive injustice as a sort of theory, right, of maternal health care and reproductive health care in the US as a reality. So this is kind of what I'm coming to this research with, this sort of theoretical framework. I am someone who studies from a reproductive justice framework, so understanding reproductive injustice is important to me. And I noticed that it's not obviously just the criminal legal system that criminalizes and shames, right? It's also political actors, but also grassroots actors as well. So, for example, anti-abortion activists, right? So, a lot of my research has to do with the anti-abortion movement and how it impacts maternal health care in the US. And so, I was really interested in, okay, what are some spaces where reproductive injustice occurs, right? And one of these spaces is outside of the reproductive health clinic, right? The local reproductive health clinic, the Planned Parenthood, or um, your kind of grassroots local independent clinic, right? And having been someone who has been around that in the past as a clinic escort, things like that, I wanted to understand. So again, this came over a long period of time of doing some preliminary research, doing some preliminary interviews with people I knew, with other clinic escorts, things like that. Why is clinic protest, right? So in the US, we have clinic protest outside of clinics. It is still very prevalent. It happens a lot. I was at a clinic in North Carolina at the time, helping them with a project, and there would be 100 protesters out during the day on a weekday, right? So why is clinic protest such an effective tool for the anti-abortion movement? We know that it is historically. So what's going on, right? How does clinic protest work and what are its consequences? And again, this is tied to the overall understanding of reproductive injustice as and the anti-abortion movement in in creating disparities in maternal health care, right? Is sort of the overall broad argument that I wanted to make, right? Or a connection I wanted to make. This is an interpretive question rather than an empirical question, right? Because we can count the number of protesters. Yes, we can look at their signs and make assumptions. Yes, we can say like, oh, they're just crazy and leave it at that, right? There's other things we can think about. But actually, what if we looked into this more? What if we actually understood what was going on so we could actually understand why people feel shame, why people oftentimes do leave clinics, right? So, what actually is going on here? How does this contribute to reproductive injustice and actually maternal health disparities over time, right? Um, and this research is inherently interpretivist because I wanted to understand how these things work, right? We can't really we can't really quantify how these things work in a lot of ways, especially because we don't know a lot about what's going on out there, right? So it's important to, in this really chaotic setting, instead of counting things, maybe go and observe things, right? And counting, I know I'm being flippant again, but so I spent 4 years outside of abortion clinics and reproductive health clinics all over the US, in 4 different states, all in different locations, geographical locations across the country. I've interviewed over 100 pro-life or anti-abortion people outside of clinics, and I've interviewed over 100 clinic escorts as well. And I observed outside of these clinics, meaning I did field work, right? So, like I said before, methodology might be ethnography, but those methods underneath ethnography can be varied, right? They can include interviewing. They can include writing, journaling, writing. They can include taking pictures and doing textual analysis of people's signs or literature they're handing out, right? They can include stories clinic escorts have had about people bringing guns to clinics, things like that, right? So it's important to note that the methodology might be ethnography, but the methods underneath it are varied. I also analyzed social media communications, speeches, media outlets, and then did some archival work, historical work to supplement. So histories of anti-abortion, what we might call quote unquote activism, right? Documented by clinics, and how clinics deal with this protest, which is a lot of different ways. What does observation look like, right? It's kind of a weird, this is outside in DC actually, of a clinic. And there was also a march after. So these pictures are directly from my field work. Observation looks like consistency, so showing up every day. Physicality, I do think, and this is something that ethnographers sometimes differ in their understanding of, but I do think physicality or being in a space is important because then you can understand the emotions or the feelings that are happening in that space, as well as the layout of a space, things like that. It includes writing down things while you're out there. It includes recording interviews, but also just sounds. It includes taking lots of pictures. And especially if you're in a public space, you are welcome to take pictures, but also IRB. If anyone has questions about doing this work in IRB, happy to also answer those questions later on as well, because that is a whole thing. But eventually they do let you do it, which is great. And I wanted to, this is a picture from one of the archives of the clinics I was at in Iowa City, Iowa. But ethnographic method practice looks like a lot of different things. But this is kind of a day in the life of an ethnographer, I would say, in a very kind of basic way. You go to your physical site. with a recorder, a notebook, a pencil, or a pen. You bring or your iPad, whatever you need to do. You bring copies of consent forms if you need them. You can also, a lot of times, ethnographers and people doing field work will not have consent forms, but will do verbal consent through the IRB, which is very helpful. When you're done observing for the day, meaning standing out there, writing, taking pictures, recording sounds, recording interviews, doing interviews with people, trying to make connections, right? I spent about 2 hours writing alone after a day of field work in a journal or documenting what I saw and how I felt throughout the day. It's important to write about your own process of research. So not just this person did this, but also like where was I? What was I doing in that space? That's very important to document as well. I would type out whatever was physically in my journal for the day as well, which I would call my field notes. And continue this every day at the site until you practically can't go anymore. So for me, that was moving, but it was also um, just realizing that I had reached data saturation, thematic saturation at that point, even though I hadn't analyzed any data yet. Just knowing that I was hearing the same stories over and over, and that was really important. But I realized at a certain point it was time for me to leave, right? And that's something that's different for everyone, and that's something that it's important to talk to other people who do field work to kind of figure those things out. And then I know it sounds real easy, but then you, of course, thematically analyze your data using different theories and methods. For me, this includes this could include both the sort of medical journal writing that you do about, semi-structured interviews, things like that, but also more prose like um, creative writing even you can make out of your field notes and publish in different spaces and places. Also happy to always talk about outlets for this kind of work. A lot of times these big ethnographic projects will turn into book projects or manuscripts. They don't always have to as well. A lot of sociologists who do this work actually do articles instead. Um, I just wanted to show you a quick example from my field notes. So this is just one example of something I wrote. I won't read it out loud, but I'll make sure these slides are available to those who are here if you ever want to go back and just kind of look at how field note is written, basically. And it's different for all different people. People write in different ways, and that's actually great. There's not, unfortunately, a sheet I could give you where you can just fill out field notes where you can kind of Mad Lib it in. You have to actually write in your own script and words in this way. So after all that work, 4 years of work, one of my big conclusions from my field work was that clinic protests, so protests outside of clinic, and this is from a clinic in North Carolina, this picture, creates a mood of shame around abortion care and blockades clinic access through these spectacles that are created. And that might sound simple, but actually there's a lot to unpack there, and there's a lot of data supporting that statement. And you might say, okay, so what's the point, right? So you document this, you understand this. It actually can influence and does influence policy. I have written a lot then about the FACE Act. So and it's basically an act that protects entrances to clinics. You might have heard about it being used actually against people in Minneapolis last summer. But it's very complicated. But I've been a proponent of sort of in policy trying to understand how do we actually protect patients and actually like lower these disparities, right, that we see coming out of this protest happening outside of clinics. And to do so, I've written a lot of public-facing articles and policy briefs actually with my research, in order to show the impact and the consequences of clinic protest. And it was really cool because this piece in the conversation was actually cited in the New York Times, which I thought was pretty cool and I was excited about. In an article about the FACE Act and its kind of complications, but why we need better legislation around clinic spaces and patient health care as well. Lastly, I just wanted to say that you can begin engaging in fieldwork even if you're not going to engage in a giant book length project about it. Okay. I think some questions can't be answered through simply semi-structured interviews, right? Not that they're simple, they're very complicated. But you can't necessarily answer all the questions you want to answer through the methods that are tried and true that you've tried before. Sometimes things stick and you need a new way of answering questions, right? So is there a question maybe that comes to mind that you can't answer through other methods or that you've been struggling to answer through other methods? Um, are you observing things around you and you notice things and you're like, wow, it'd be really interesting to really think more about that, right? Write those things down. Even if they don't end up going anywhere, it's really important. Observation is important. So even if you're, for instance, doing semi-structured interviews and you want to incorporate a tiny bit of like fieldwork method into your work, you can always maybe right after you've done your interview, right? So how did you feel doing that interview? What did the other person kind of, what were they giving? What were the feelings in the room or even in the Zoom room as you were talking? What are some things that you gleaned from that interview that you wouldn't necessarily be able to later when you're looking at those notes or that transcript, right? In vivo or something like that. Talk to people, see what questions they might have. Um, that might be similar to yours. Maybe often ethnography sometimes is a solo kind of work, but it can also be collaborative. I truly believe that. And you can, and you, oh, you can get to an ethnographic project through other methods like interviewing first. So that's something I did was I interviewed clinic escorts, people that help, you know, patients into clinics outside of reproductive health clinics. And I noticed that people really wanted to share their stories and understand what was happening outside of people to understand what was happening outside of clinics. So interviewing first is a really great way to start a fieldwork project. I just wanted to quickly touch. I don't know if anyone in this room had questions about autoethnography, but it's a completely different approach to research and writing, actually. So it takes ethnographic methods, but it connects personal experiences with broader social, political, cultural contexts. And it draws on lived experiences of the author. Um, but it's not about the author's perspective necessarily. It's about a group or community of people. So in that way, it's an ethnography as well. I know sometimes people misuse the term autoethnography to talk about like, I'm sharing my experience. So maybe I'm a doctor and I want to share like an experience I had. I would say that's more of like a case study, right? It's more of something, autoethnography is about marginalized folks coming and telling stories that we don't normally hear, right? And thinking about ways that um, we can share our personal experiences by connecting them with broader contexts, right? So just wanted to put that out there. I know sometimes this word gets thrown around now, but it's a really specific method, and I'm always happy to talk more about that as well because I also have done autoethnography. Um, yeah. Thank you all so much. If you have any questions, feel free in the chat or just want to chat about qualitative research or talk about something you've done that you feel like aligns with fieldwork, I'm happy to talk about that with you all. And I'll just stop sharing my screen.
Thank you so much, Micki. Looks like we have a question. Go ahead.
Yeah, hi. Thank you for presenting this. It is very informative. I actually joined from University of Texas in Houston. One of my colleagues shared a link, and this is very informative. My question to you is, I'm also a qualitative researcher, and I do, a lot of studies. But regarding your ethnographic, um, methodology, we do in descriptive or phenomenological approach, we do field notes, we do observation, we do write field notes, and we go to the field. And how is that different from the ethnography? I mean, I'm trying to still understand the difference and the between that.
Is it Dauncey? I'm so sorry. Is that
Yes, yeah, John.
yes, Dauncey? I would say that you are engaging in ethnographic methods. If you are doing field work, you're writing field notes. You're sort of doing If you're doing descriptive writing, if you, like you said, are doing a sort of phenomenological approach, which is interpretivist, right? I would say that you are engaging in ethnographic methods, and it's just another, I think, way of describing. Obviously, disciplines vary in the ways that they describe what they're doing. Ethnographic projects often end up in sort of larger scale projects. So if you are doing them over a longer period of time, right? I would say that thematic saturation often comes with things like more interviews, more field notes over a longer period of time. But that doesn't mean that you're not engaging in ethnographic methods if you're doing those things even in short-term ways. Does that make sense?
Yes, and that brings to the next question. Is there a time that you
Yeah.
say ethnography, like we
Yeah.
should have so many months or years or what?
Yeah. It's really hard. It varies greatly between different disciplines as well. So anthropologists will tell you one thing while sociologists will tell you another. But I believe that I'm from sort of a discipline that believes in sort of thinking about thematic saturation as a way to understand it, right? So have you been in a space long enough that you're seeing those same themes come up again and again, right? How long do your interlocutors or the people that you're engaging with want you there, right? So those all vary greatly. How long can you be in a space, right? So for example, I was in these different spaces for 4 years. I wasn't in all of them for, 4 years. Sort of went from the Midwest to the South to the East Coast, to the Midwest again, sort of understanding that these different spaces had different time limits, different time needs for me, different capacity for me to be there, right? There might have been a clinic escort program at one that told me I could stay there indefinitely, right? Versus in in more precarious places where clinics really were worried about safety, they might not be as open to you being there as long. So I know that's not a straightforward answer, but I think it varies, and I don't think that it has to be a certain length of time for you to call it an ethnography. I That's a hot take to anthropologists sometimes, but who believe sometimes you need to be in the field for years. But there's also a lot of restraints to that. We saw that with COVID as well. That actually did put some pressure on people who do this work to not be in these spaces as long or to not harm. If you're, it's also understandable to it's also good to understand the community you're working with. Is it harmful for you to be there, too long? Things like that, right? If people, a true ethnography, includes that situated knowledge that really understands the needs of people, where they're at, right? So I think that, that's not a very specific answer, but hopefully helpful to broaden the scope of what an ethnography is, at least. It doesn't have to be specific time.
Okay, thank you.
Mhm.
Any other questions? Also, please feel free to put them in the chat if you're unable to come off of mute.
And if anyone is doing, utilizing these methods and ever wants to, talk about it or, needs some advice with IRB or is interested in thinking about using these methods, feel free to reach out. I'm happy to help as, part of Amethyst, but also as a fellow, maternal health researcher and reproductive health researcher.
I can put Micki's email in the chat as well for reference. You mentioned earlier with the IRB that it can sometimes be tricky putting something together for an ethnography. Do you have any quick, and I know that based on the content of the research, it will vary, but any tips to starting that out? Any, things that you've experienced in submitting IRBs that you could give guidance to people as they prepare to do this sort of work?
Yeah, I mean, maybe people have different experiences. I've been at a lot of different institutions over the past like 10 years, and I found that all of them differ greatly in the ways that they take qualitative research seriously or not, or will really analyze it. University of Delaware I'm at has is very strict about it. And so it's really helpful to talk to your IRB person before you even start the process, so they can guide you in that. And I would say that also making sure you use language. So the methodology can be ethnography, right? But also using really specific language about the methods you're using, right? Are you doing interviewing? Are you doing participant observation, right? Keywords like that that will help you. So maybe you don't need to necessarily say, I will go back and write in my journal, right? But you should say, I will be engaging in participant observation, right? Um, yeah.
Absolutely. Thank you. That's super helpful. We just got a question in the chat. How did you maintain objectivity and calm when interviewing people who have such drastic reproductive opinions than you?
I get this question a lot because of my research. My manuscript is on the anti-abortion movement in the US, and I've spoken to, so the clinic protest is one facet of this larger project, on how the anti-abortion movement impacts maternal health care in the US. And I would say that ethnography is, you know, not necessarily easier, but when people are more welcoming to you, as well as you have similar opinions and backgrounds and theoretical frameworks for the world, orientations toward the world, it can be more gratifying in that moment, right? For me, it's complicated. I grew up in the anti-abortion movement, actually, so that's how I sort of think about these things is, from a very different perspective now. So I have a lot of experience around people with varying political and reproductive health care views, which can help in that way. So if you're going to do something like field work, make sure that you take care of yourself as well, because it definitely can be hard. I would say I definitely didn't maintain objectivity. So that's the other thing, is what's interesting is that I would completely tell them who I am, what I believe in. I would say, that I am for reproductive justice and, full access to reproductive health care continuum. And based on who you're talking to, people will want to talk to you or not. And because of their belief in sort of evangelizing to me, their views, they were willing to talk to me, right? But that won't be the case with everyone. And it's also important to understand that's why situated knowledge and your own standpoint as a researcher is really important to think about when we're doing ethnographic methods, because who you are does impact the research, and that's just how that is, right? I might be talked to in a different way than someone who doesn't look like me, right? Who isn't me, right? Doesn't have my background. So that's again a longer answer. It was hard, but it definitely was not. I did not take an objective approach. It was definitely more of like coming with my whole self and my biases, and being honest and upfront about that.
Great question. Thank you so much. Anything else? Let me put your email in the chat. Parting words for us.
No, thank you all so much for listening about methods on a Friday, and for listening to me talk about, um, reproductive health care, as I know that we all care about. So, if you ever have any questions, feel free to reach out to me, or your sites if there's any questions about doing qualitative methods outside of sort of the norm, I would say, in maternal health and implementation science. I do think that implementation science and ethnography are very synergistic, and I believe that the best way to kind of ultimately implement something is to really understand it from a variety of standpoints and perspectives, and ethnography helps us do that. So, happy to always talk about that. Um, Great, thank you so much.
Wonderful. Well, thank you so much, Micki. For our attendees, I just put their email in the chat, so you
Awesome,
guys will reach out.
wonderful.
But thank you